Anemia interpretation. If anyone have below than the normal range of hemoglobin, below than normal range of hemoglobin, normal range male 13 to 16, female 12 to 15. Different book have different data, but be taken male 13 to 16 and female 12 to 15. Then check MCV, also given in CBC report. MCV, mean corpuscular volume. Here is three possibility: low MCV, normal MCV, or high MCV. First we take normal MCV and low MCV. If anyone have low MCV, low hemoglobin low plus low MCV, mean microcytic anemia. Patient have microcytic anemia. Then check for serum ferritin. Check serum ferritin, and if serum ferritin is also low, low hemoglobin, low MCV plus low serum ferritin, then patient have iron deficiency anemia. If patient have normal iron ferritin, then check total iron binding capacity. Total iron binding capacity. If total iron binding capacity is also low, normal ferritin but total iron binding capacity is low, then anemia of chronic disease. Anemia of chronic disease. And if normal total iron binding capacity, then patient may have thalassemia, lead intoxication, or rare case sideroblastic anemia. This is all low MCV, if patient have low MCV. If have normal MCV, low hemoglobin but normal MCV, normal mean corpuscular volume, or MCV, means normocytic anemia. Patient have normocytic anemia. Then check reticulocyte count. If patient have low reticulocyte count, then check WBC and platelets. Both are also low, then patient may have aplastic anemia or leukemia. If low reticulocyte but normal WBC and platelets, then patient may have anemia of chronic infection or patient have chronic kidney disease or any chronic inflammation or may have malignancy. If reticulocyte are normal, patient have low hemoglobin, normal MCV, but reticulocyte is high reticulocyte. High reticulocyte, then patient may have acute blood loss or any hemolytic disease or splenic sequestration. Third, if patient have low hemoglobin but no high MCV, low hemoglobin but high MCV, then patient have macrocytic anemia. Then check for B12 and folic acid. If both are normal, then patient may have any hepatic disease that cause anemia or hypothyroidism or drug induced anemia or reticulocytosis. If patient have normal B12 but folic acid are low, then patient have anemia of folic acid deficiency. If B12 low and folic acid normal, then anemia due to vitamin B12 deficiency. Quick revision. If anyone have low hemoglobin and low MCV, then check serum ferritin. Is serum ferritin also low, then patient have iron deficiency anemia. If serum ferritin, then check total iron binding capacity. If low, then chronic anemia of chronic disease. If normal total iron binding capacity, then patient may have thalassemia, lead intoxication, or cerebroblastic anemia. If low hemoglobin but normal MCV, then patient have normocytic anemia. Then check reticulocyte. Reticulocyte is low. If low, then check WBC and platelets, and WBC and platelets also low, then patient may have aplastic anemia or leukemia. If reticulocyte low and normal WBC and platelets, then patient may have anemia of chronic disease, chronic infection, chronic kidney disease, or chronic inflammation, or any malignancy. If high reticulocyte, then patient may have acute blood loss, hemolytic disease, or splenic sequestration. Low hemoglobin but high MCV, then patient have microcytic anemia. Then check for B12 and folic acid. If both are normal, then patient may have hepatic disease that cause the anemia, hypothyroidism, or drug-induced anemia, or reticulocytosis. If B12 are normal and folic acid is low, then anemia due to folic acid deficiency. If B12 low, folic acid normal, then anemia due to B12 deficiency.